Welcome to Prognosis, the most cost-effective, comprehensive EMR system for your OB-GYN practice today.
Here I've logged in as Dr. Marcus Welby. At a quick glance, I see a nice summary of my inbox messages, including lab results that I can approve. I can also delegate follow-up. Any of the numbers here that are in red mean they're past due. Down below, I can see the patients that are coming in today, the reason they're coming in, and a nice continuously changing status. So as a patient walks into the waiting room and gets checked in, I can see that they've arrived and I'll know what room number they're being taken to. If my medical assistant is currently with a patient, it will automatically update the status. And as I complete my encounters and move on to the next patient, it'll say complete. Obviously, it would be wonderful as the day progresses if each of these was able to say complete, but that may not always be possible as you're getting distractions and having to work on multiple patients at the same time. So you can always refer to your open encounter list where you'll see a work in process list. These are all the charts that you have opened but that you haven't signed off. And they might be from earlier today or from yesterday. You can go back to any of these patients, finish what you are doing, and when you sign off electronically, they'll be removed from this open encounter list. Anything that's in this list is not getting billed, whereas any of the items that you have completed, as in this first one, has already been sent over automatically to the billing module. Other items of interest on our homepage are our ARAR Dashboard. You'll see up here at the top, I have a button that allows me to quickly see how we're doing with our clinical measures and how far we are from meeting our meaningful use requirements. I can run this for one provider in the practice, all providers between any date range. This gives me a nice snapshot overall for the practice, but also working individually on a patient, I will know what I'm deficient in or whether I'm completing everything I need to with regards to meaningful use. The adjacent button, my Compose button, allows me to quickly send messages to my staff. Notice here that if I'm ready to look at an existing patient, Rachel Jones, I just simply click on the patient. She's in room 16, and I can pause outside that room and very quickly get a snapshot of what's going on with that patient. If this patient is coming in as a GYN patient, I might look at this face sheet, which is her general allergies, past medical history, past surgeries, current medications she's on, social history, family history. I can see her OB as well as GYN history as well, nicely displayed. Now, if she's coming in as an OB patient, then instead of looking at this as the default view, I might be looking at her prenatal flow sheet. So you'll see that I can have quick access to the appropriate types of data depending on why the patient is coming in. If I wish, I can come into any of these areas in more detail just simply by clicking on the window. You'll see on the left-hand side, I also have a nice configurable workflow, and perhaps I'd like to just quickly see what's been going on with this patient previously. I can click on my document list and see all of the items that are in the patient's chart, whether they be progress notes, lab results, etc. I can open a preview pane so that whatever I highlight in the top half of the screen, I can easily view the details in the lower half. So this is a nice way to be able to review what's been going on with this patient since the last time they were in. If I'm ready to proceed with my visit, I may want to check the vital signs that my medical assistant has taken. I can very quickly see that the GYN vitals have been taken. If I wanted to view the history, I could click on the history button to compare any weight changes from the past. I also have a nice green arrow down at the bottom that points to my history of present illness. These green arrows are very configurable. You can lay them out in any way that you like. Here it pops up a list of the most common reasons that patients come to see you, and I can see off to the left-hand side the reason why the appointment was made. She's coming in for her annual visit. She's also perhaps got an abnormal pap and also complaining of headaches. So she may think of other complaints later on, but right now we'll start with these. Notice I have a nice template for my annual visit. I can quickly mark if there's any other problems. Does she do a self-breast exam? Yes. And all of these other items I can quickly go to the default unless there's any requirement to change anything. Notice that if I choose the abnormal pap on the left-hand side, then I have a totally different set of questions, and I can easily mark the appropriate data. There's nice drop downs. These are all very, very configurable. As I come to the headaches, then I'll have a nice template for that. You can always skip this. You can always come down for this particular complaint and says, you know, I'd really just rather type. You can by all means do that. But templates will give you nice notes with nice English sentences as you fill them out. Notice that I can mark if the patient's doing worse or better, what's their progress. Some of the items will be what we call multi-select, where you might need to choose more than one item. If the patient has been here before, I'll see a copy button in the upper right, and I can actually copy from a previous visit and make changes. If I'm done here, you'll see the green arrow at the bottom right happens to be pointing me to a review of systems. Here in the review of systems, I can decide, is this maybe a post-op or a pre-op or a follow-up review of systems, or is this one good that I've got in front of me? If she's pretty healthy, I can check everything instantly with one check, or I could come down one at a time. And each of the organ systems that I click on, I'll see the details to the right. So if I choose genitourinary, then you'll see that if she complains of frequent urination, I can quickly mark those items. And notice any of the items, they get marked with a nice little red abnormal box. You can always put in your comments to the right if you like, but you also have these nice little binoculars that'll save your favorite phrases. So I can always choose from those, or if I needed to, I can add additional items. As I click on cardiovascular, I'll see the cardiovascular questions to the right. And so she indicates palpitations. And then you'll notice that any of the organ systems where there was a positive, it shows a red box. If I'm done with this and I want to go to my objective, the green arrow at the bottom right happens to be pointing me to my physical exam. I can choose which particular physical that I want, for annual GYN or GYN exam over 49 without uterus, with uterus. So it will automatically pull up the defaults, but of course you can override. And again, I can come down one at a time, or I can check everything off nice and quickly. If there's any problem though, again, patient maybe is in some distress, I can mark those areas, and very similar, whatever I choose on the left-hand side, I can very quickly mark those areas as necessary. If I want to, again, jump into my binoculars, I can quickly choose from those. And as I go to my GYN exam, I'll see those particular areas in detail as well. And I can always elaborate on any of these areas as necessary. At any point, it might be desirable to be able to annotate in a diagram, so you can always pull up your diagrams and choose the appropriate one. Whether it be the human body, or if I need to go straight to my OB diagrams. On the breast, I can mark exactly where we might have seen a lump or swelling. Notice it creates a nice little table to the right. And with my clock diagram, it'll know exactly where that is, and I can put in any notes on any of these areas. So very easy to mark, and of course everything that we're doing will all be a part of your note. So at any point I can go look at my progress note. Notice the progress note has nice sentences based on the point and the click, but you could have also used Dragon, medically speaking, for voice recognition, handwriting recognition. Besides the HPI, it also brings in all of the past medical history, surgical history, current medications, social history. We see the review of systems, any positives shown in bolded text. And as we come down to our objective exam, we can see also the diagrams, if that's desired in your note. If I decide to go do some assessment notes, I can choose assessment on the left-hand side. As I come in here, notice the system will help me to choose likely ICDs. I can choose those, or I can jump into my preferreds by choosing this plus sign. I can do separate assessment plans if I like for each of these, depending on which one of these diagnoses is highlighted as I fill in the boxes to the right. As I come in here to perhaps jump into my plan phrases, I can access those nice and easy. So annual visit, I might have my favorite phrases. And offered options of birth control discussed with a patient, and STIs were discussed. So I can pop in my plan phrases very nicely, edit those. Notice that as I choose the PAP diagnosis, both of these blank out. And again, I could jump into my favorite phrases, or I could simply type whatever I need to. Very easy for you if you ever need to add your own phrases. Very easy to do just simply by clicking on the plus sign here. But I'll just choose follow-up was discussed, and notice that pops in there. So for each of these, depending on which is highlighted, I can see the details to the right. And of course I could have put in some assessment as well, or I can just let the ICD stand for that. For follow-up, we want this patient to come back and see us maybe in 2 weeks, and the reason why? Maybe we want to review her labs. So this will go as a pop-up message to the front desk before the patient even gets up there. They'll already know what needs to be done. And I can use these buttons down here to get the lab ordered, radiology, a consult, or medication. So this will pop you again right into your preferreds, and you can get the appropriate things ordered. And it'll go on a nice order sheet for the nurse to finalize. E-prescribing is also built in. We work with SureScript. You can send your prescriptions directly to the pharmacy, so it knows the patient's preferred pharmacy, and whatever drug that I type, whether it's a brand new drug or I pop up her medication list and refill something, all the drugs are kept right up to date. And I have all the information about the medications. I can pull it up, print it out for the patient along with any other educational items. Or I can just very quickly hit my ERX button, send it directly to that pharmacy, or I could print it out and give it to the patient as well. As we come to the end of this encounter, we might want to know, well, what can we bill for? So we have an ENM Calculator, allows you to choose the appropriate code. So it can dictate or help you decide what is the best code. So it says here we could do a 99213. To qualify for the next ENM, if we had just reviewed some of her past medical history, family history, social history, then that would have gotten us to a 99214. So we see the 99213 is highlighted. We can confirm it, we could override it, or we could use our time factor. And then we're ready to close our encounter. As we close our visit, we have a nice summary of what we've done today. We have our follow-up in 2 weeks to review labs. I just simply mark the encounter complete. And anything that I've forgotten, I haven't sent a letter to the referring doctor yet. If I answer yes, it'll automatically send a nice letter to that physician via fax or email, whatever is the preferred mode. As we complete our encounter, the system will tell us if there's anything that we're missing for our meaningful use on this individual patient. We have a chance to correct and go back and change any of those things. Otherwise, we are done with this patient. As we come back to the home page, we can see that this patient is now complete, and this information has already gone over to the billing department.